There's one exercise that I think confuses people the most. And we've talked about it before, but I'm going to do this one again because I want to make sure we're clear about what has to happen. So this is about bracing. Why bracing is important? Because there are changes of the vertebrae that you have to be aware of. And it's good for back pain, and it's good for herniated disc, but it's also good for bulging disc, degenerated disc. Any part of the disc that's breaking down is going to change the way the vertebrae and the disc move together, one on top of the other. It's a unique structure, and when you have some challenges, it can perpetuate and it won't go away. So, education about back pain is absolutely the most important. It's important because when you understand why you have the problem and what needs to be done, you're more likely to do it. And that's just not me saying it. Those are studies proven that when you get it and you understand it, you do it. And when you get it, you understand, you do it, it gives you what? Control. It gives you control. It empowers you. It gives you autonomy. That's the goal. You can live pain-free. So, education. That's why I do these. Now, there's 5 steps to eliminating back pain. Number 1, move well. When you move well, okay, and you're not having sloppy movement patterns, then you start to heal. Number 2 is create stability. This is the area where bracing lives, in the stability. Although technically, and we've talked about this before, in the functional continuum, they're all interconnected. You need one to help the other. But in this particular case, healthy movements, and you need bracing for healthy movements, but bracing is the area where we're creating the stability. So we're going to have to talk about what instability is because you need to know why you're doing it. But stability is the one component of what we call the functional continuum. You have a problem because you have abnormal function. You have a herniated disc because you have abnormal function. You have a degenerated disc because you have abnormal function. One vertebrae on top of the other. The disc in between. Key here is there's little joints in the back. We don't spend a lot of time talking about these little joints, but we always say there's 3 joints to the spine. There's the disc joint. It's not technically a joint, but it's like a joint. And you've got 2 little joints in the back called facet joints. They all need to work together very well. And when they don't work together very well, that's when you start to have problems. So this key is this facet joint with the disc. We know the disc is like a jelly donut in the sense that the outside of the disc, there's a thick material called the annulus. The inside the disc, there's a jelly-like substance. The jelly-like substance can move around, and sometimes as it moves, it starts to aggravate the annulus and causes inflammation. Inflammation hurts, but also causes the disc to get a little bit weaker, and then you develop little tears. As it tears, what happens? You sometimes develop a bulging disc, and sometimes it'll tear further through and create a herniated disc. But as all this is happening, it changes the distribution of the load on the annulus. You want an even load in all directions. But what can happen when you change that even load, then the nucleus starts to push out. Well, what that does is allows for the vertebrae to move in positions that it really shouldn't move in. And it's happening because the jelly is moving and sometimes drying out. And it's like having a flat tire. A degenerated disc, or a bulging disc for that matter, is the beginning of your flat tire. When you have a degenerated disc or a bulging disc, the movement gets what we call a little sloppy. And as it gets sloppy, what can happen is it can start to move. This is the degenerated disc. Healthy disc, thick disc, degenerated disc. When it happens like that, it gets sloppy. So the instability is the abnormal motion on the disc and the joints, on the facet joints. What does that do? Causes pain. Starts to cause abnormal motion over an already injured disc or a disc that's torn or breaking down. That will cause you pain. But that will also perpetuate the breakdown process of both the facet joints and the disc. The facet joints will become arthritic. Muscles will physically get weaker, and it has everything to do with the fact that the neural drive decreases. We're going to do a video about that tomorrow because you can physically see it on an MRI. And I want you to see it because the more you understand, the better. So what does that mean? Vertebrae can go this way, front to back. That can be painful on the joint and on the disc. Okay, it's because that disc is like a jelly donut and the jelly's starting to become a little bit dysfunctional and or leaking out. Okay, same thing with those degenerated discs. It's even worse because then you start to get problems with the bone. That's a different kind of problem, but they all can be addressed with the bracing. And then you get the abnormal motion over the facet joint because the disc isn't doing what it should be doing. We've seen this on our MRIs. We do motion pattern MRIs. We see the disc move in and out, but we also see the way the vertebrae shift. They will shift into abnormal positions. That's called instability. So what's the goal? The goal is to have healthy movement patterns, which is really designed to make sure you're not over flexing and extending, and then avoid the micro movements of the vertebrae. Because even a little movement of a millimeter can be very, 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 very painful. And when you get those little movements, very often it'll shut off the nervous system. It's this subtle movement that will change the way the nerve signals the rest of the body. So what do we have to do? We have to brace. How do we brace? We brace in a way that holds everything together. And it prevents that micro motion. It prevents the over-flexed spine. Okay? Proper movement patterns with proper bracing. Okay? Avoid the flexion or the extension of the spine depending on what your bias is. Now, there's two muscles that really do this very well. Transverse abdominis. Okay? It's not the rectus right here. It's not this muscle right in the front. It's the muscle sort of lateral to the front. So the belly button would be here. It's 3 inches off the belly button, and then it wraps all the way around to the back. That's number one. Obviously, you have it on both sides. Okay? Have to work that area. It's not the rectus, as we talked about. It's the obliques. But there's also the multifidus. We haven't talked about the multifidus, but the multifidus is the one that actually attaches to the spine. Okay? These other muscles, okay, they attach to the front and then they work their way around the back, where this one actually controls the spine. This muscle here, the multifidus, controls the movement of the vertebrae. It's not really designed to do all the motion, the bigger motion of the spine. That's these other muscles that are slightly above it. Okay, the lower muscles, the multifidus, are deep, deep, deep inside. Okay, they run right along here. That's the multifidus. That controls this motion, abnormal motion, front to back, side to side, rotation, overflexion, overextension. That happens right here. It's not designed to lift heavy weights. It's really just designed to hold the disc in place, the vertebrae in place. Again, different muscles. Some people say, yeah, my muscles are tight, but they're tighter up in the thoracics. Not the same thing. So how do we do it? It's about neural drive. It's you waking up the nerve that goes to those muscles. So, that muscle here, it's on your side. Okay? What I'm going to have you do is I'm going to have you relax everything, and then you're going to push your fingers in to your side, and then you're going to use those muscles to push them back out. That's how you activate these muscles. Now, do you have to do it all the time? No, but you have to make sure it's there. You have to make sure it's working. So that's this muscle right here, but then you have to activate the multifidus, and that would be the muscle on the back of the spine between the vertebrae. So you're going to put your fingers right here. Okay, here's your hip bone. This part, this would be where your belt is, right here. Just right there, and you're going to feel them. Sometimes people say, yeah, one side seems a little tighter than the other. It might not be tighter, it just might be bigger. We'll talk about that one tomorrow, because they will physically get smaller when there's an instability in there. So you're going to put your fingers in there to make sure they're being activated. It's not easy to do. Okay? So what you do is you're going to push, you're going to relax the muscles. Let everything relax, and then you're going to push in. Everything's relaxed, I'm pushing in, and then what I do is I push out. I figure out what muscles push my fingers out. That's bracing. Just like that. So push your fingers in. It hurts a little bit. It's going to hurt a little bit. You don't want to hurt your back, but you got to wake those muscles up. So fingers go in, and then you push out. Same thing. Okay? You can push your thumbs here, push your thumbs in, and see what's going on with your low back. Push out. Just like that. That's bracing. Holds the vertebrae in place. You have to be able to breathe, but more importantly, you have to start to wake them up. Start to wake them up. You can even just sit in a chair. Relax, push out. Relax, push out. Just remember, it's these muscles starting from the 2 inches off the belly button and then all the way around to the back. Okay, same thing. Activate them. Activate them when you're going to do an exercise. Activate them when you're opening the door of your car. Activate them when you're opening the door of your house. Activate them when you're getting off the toilet. That's the brace. Wake them up.